On behalf of the Centers of Medicare and Medicaid Services, the Administration on Aging, and the Aging Health Service, I would like to welcome everyone to the Long-Term Services and Support webinar series. My name is Julie Cahoon, and I work for Kaufman and Associates. I will be your moderator today. I would like to start with introducing your webinar interface. You should all see the first slide of the PowerPoint presentation, the Q&A box, and welcome box open on your screen. The webinar screen in your browser belongs to you, and you can customize your interface by opening and closing the icons and windows, moving the windows around, and resizing them as needed. We will have a closing Q&A session. However, please feel free to enter a question for the presenters in the Q&A box at any time. The goal of our webinar today is to get feedback from all of you on this newly redesigned website. So there will be plenty of questions and opportunities for discussion and input, and we hope our session today to be very interactive. If you're called in on your phone, you can unmute your line to speak by pressing *6 to give comments. Please remember to mute it again after you finish speaking. If you're listening to audio over your computer speakers, you can enter any of your comments in the Q&A box at any time during the presentation. If you need technical assistance during the webinar, please enter your tech support question in the Q&A box. Our tech support staff will be monitoring these questions throughout the webinar, and we will work to answer tech support questions right away. You will receive an answer in the Q&A box. Finally, please be aware that today's webinar is being recorded, and that the recording will be made available online on the CMS.gov website in the near future. Today's webinar is titled LTSS Resources Online, the LTSS Technical Assistance Center. I would like to begin by briefly introducing our speakers. Adrian, Kristen, and Sarah work for Kaufman and Associates and have worked to develop the LTSS Technical Assistance Center. Adrian Wiley is a research associate and project manager at Kaufman and Associates with a background in public health and community-based participatory research. As part of the research and evaluation team at Kaufman and Associates, Ms. Wiley works to provide LTSS resources to tribal communities and to highlight program and service innovations found throughout Indian country. Dr. Kristen Hudgens serves as the Deputy Director for Research and Evaluation at Kaufman and Associates. Dr. Hudgens has directed numerous research and program evaluation efforts, including a study for the Centers for Medicare and Medicaid Services, examining health services across barriers. Sarah Peterson is the senior writer at KAI and has been involved with the LTSS PA Center and Roadmap since it was created in 2013. She works closely with Kaufman and Associates digital media team in planning and implementing a redesign of the LTSS PA Center. And she'll be listening carefully to your feedback today to see what changes or additions we might make to the website in the future. Welcome to all of you, and thank you for presenting with us today. I will now turn it over to Adrian Wiley.
Great. Thank you very much, Julie. Good afternoon, everyone, and good morning to all of our participants calling in from the West Coast and Alaska. We are very grateful that you've taken the time to join us today. We are excited to demonstrate to you some changes that we've made to the Technical Assistance Center, or TA Center for short. What we'd like to do today is demonstrate how to navigate through the site, how perhaps you might use some of the resources, and what some of the new resources are available on the site. But most importantly, what we'd like to do is use this as an opportunity to get feedback from you, as you are the intended and desired users of the website. So we, as the designers of the content and where things go, want to make sure that this site is as useful to you as possible. However, we need your feedback in order to make sure that that happens. So please, as Julie mentioned, feel free to ask any questions throughout the presentation. Also, if you have any comments or opinions about the site, things that you wish you could see, perhaps that are missing, things that aren't working for you, please also don't hesitate to let us know about that. Either call in to let us know, or just type in your comments into the Q&A box or into the chat screen, and we will be sure to address those. So getting started, we would first like to find out if anyone actually had an opportunity to use the TA Center. So in order to do that, what we'd like you to do is to just click either yes or no, and then hit the submit button. And we'll give you a few seconds to respond, and then we'll get started from there. Okay, just moving forward quickly, it looks as though not quite a quarter of our audience had an opportunity to use the website. What we would love to hear about, however, and Kristen, I might hand this over to you, is if anyone would be willing to share their experience using the website.
Yes, this is Kristen. What we'd really like to know is, for those of you who have been on the previous LTSS website, what were you looking for? And you can either speak your answer or put it into your Q&A box.
You can also hit *6 to unmute. We'd love to hear back from you.
Okay, I see somebody has shared they were looking for best practices. Great.
Okay, and I apologize if there's been any sound issues. Please just keep letting us know, and we'll try to resolve that throughout the webinar.
And resources. Okay. Thank you very much for that. We really appreciate it, and we'll be asking you more questions as we continue along. Go ahead,
Okay. So let's continue forward. If you do have your computer, if you have the capability of doing so, we will be providing today a preview, as I mentioned, of the redesigned long-term support services and support technical assistance center, or TA Center for short. If you go to this address here, http://ltss.kaufmaninc.com, it'll provide a preview for this site, and you'll be able to follow along. That being said, we will also be providing a screen share of the site so that you will be able to see it itself. If you do happen to go to the site and let me pull up the site here, type in ltss.kaufmaninc.com, you should be able to see our landing page, which is currently loading right here. So again, please feel free to type in that address. During the presentation, we'll be bouncing back and forth while demonstrating the different sections and resources available within the site. So for those of you who aren't familiar with the site or who have not been able to visit the TA Center yet, the TA Center is an online center with different resources for health planners and health planning communities. This site that we've given you is the beta site. So when the new site is ready to go, you'll be able to access it through CMS.gov. And in fact, that's where you can access all of the resources through the currently existing site. When you go to CMS.gov, we are available through the outreach and education area for American Indians and Alaskan Natives. So again, just to reiterate, today's presentation will be just looking at the beta test version of the site. So it's a little bit different in terms of content and how it's set up. The TA Center is going to be updated to the version we're showing you today within the near future, so before the end of the year. And also, just to reiterate, what we'd really like to do today to make sure that we can implement any changes based on your input. So any and all feedback today would be very much appreciated and welcome with open arms. Now, when we're talking about LTSS, long-term services and support, what we're referring to are a broad spectrum of health and social services. And these services are designed to support elders and people with disabilities who need help with what are referred to as activities of daily living or daily living tasks. So those things can be like getting dressed, transportation services, meals, that sort of thing. Now, LTSS can be provided in either the home or in community or in a facility. So there is a broad range of environments in which it can be provided. So again, this refers to medical and personal services, helping people with functional limitations, specifically elders and people with disabilities. And again, the idea is to help people live as independently as possible. So while facilities sometimes are really the best option for an individual, or perhaps the only one, ideally that is something you work towards, and rather than going straight to facility care, perhaps starting with home and community-based service options first. Now, the TA Center itself is, again, meant to be as a resource for tribal communities, particularly for health planners and health directors. The idea is that it's meant to appeal to a broad base of potential users. So that includes individuals and community representatives from reservations, those in rural areas, or those whose services are needed to attend to individuals who live in urban areas. The actual site itself is the result of a partnership between three separate federal agencies, specifically the Centers for Medicare and Medicaid Services, CMS for short, the Association for Community Living, and the Indian Health Service. So these three groups together have partnered in order to make sure that these resources can be made available in a timely manner and can also be used to help different tribal communities develop and then evaluate these services within their own areas. Now, specifically when we're referring to LTSS, we're talking about a litany of services, and these include caregiver client training, case management, dietary management, specifically by dietitians, disease prevention, durable medical equipment, health promotion, hospice care, medication management, occupational therapy, pharmaceutical access, personal emergency response services, physical therapy, respite care for caregivers, skilled nursing, and speech therapy. But it also covers perhaps some more services that are maybe thought of as non-traditional, or maybe perhaps are what you immediately think of when it comes to LTSS. So these things also include, adult daycare and senior facilities, financial management, helping people, helping individuals with bill paying, or helping monitor their finances to avoid any kind of financial exploitation, home delivered meal programs, particularly those under Title VI auspices, home safety assessments, repairs and modifications, homemaker and shore services, nutritional meals at congregate sites, information and referral services, legal services, personal care, as mentioned before, assistance with stressing and behaving, telephone reassurance, and also transportation and mobility access. So again, these hopefully give you an idea of just how broad a range of LTSS services are when we are talking about LTSS. And so the site in this way is meant to provide resources to help you design determine what might be useful, and then design those appropriate programs that best fit the needs of your community. Now, within the CA Center itself, I'll be demonstrating this in just a moment here, it consists of a handful of sections, and within each of these is where you'll find all of the various resources here. The information, the planning, and the program examples are some of the main sections within the site itself, although you do also have access to monthly newsletters that we send out to our listserv members every month. And if you come to the CA Center, you can actually access previous versions of the newsletter as well. You can also come to the website and see the webinars. As Julie mentioned before, this webinar itself will be posted on the CA Center. You can actually go to the website and see webinars going back to, I believe, 2012. We've been doing these every month for a while. And they cover a large range, I keep saying that, but they do cover a large range of different LTSS-related topics. So you can come and watch webinars or read the transcripts of webinars covering topics such as medication management to prevent abuse, looking at different programs throughout Indian country, looking at Menominee, Oneida, Tohono, looking at some of the things that they've been able to use in their communities and perhaps use those as a launch pad for something that you'd like to do within your own community, or even looking at different issues and policies such as nursing home facilities, hospice care, that sort of thing. So again, if you are able to and you have not yet done so, we encourage you to go to the beta site. Again, it's just LTSS.com. If there are any questions so far, as we've mentioned before, please do not hesitate to go ahead and jump in, write us a comment, or you can hit star 6 at any point and let us know if it's something that you're not seeing, something you want to see, something that you have used in the past to greatest success, or something that could have been improved. We welcome any and all feedback. So again, I am going to hand this over to Dr. Hudgens to discuss a little bit about our PA Center homepage, and this will be another opportunity for us to get some feedback from our audience.
So for those of you currently on the homepage yourself, and I believe Adrian is also going to access it for you, what would you say stands out to you first about the homepage? Especially for those of you who may have been to our previous website, and for those of you who are new to this website, what is the first thing that catches your eye?
Some of you must be typing in some of your comments right now to send to Kristen and I, but what I'd like to do is take a quick moment to highlight a few quick things on the launch page. As you can see here, we have our the general discussion of what is LTSS. So again, you can see what it is we're discussing when we talk about that particular topic. We do want to highlight that if you're looking for long-term care, this is not the actual resource you want to use. You can instead click here, and it will take you to the appropriate site. Likewise, if you have a complaint about long-term care, if you suspect something amiss is taking place with a family or friend or loved one, or if there is some dissatisfaction you have about the long-term care or maybe the lack of it in your area, instead we have a link that will lead you to the appropriate resource for that. And just demonstrating quickly up here on the left-hand side up in the corner, you can see here the sections that we were discussing earlier. We have our info, our LTSS newsletter, our webinars, planning resources, and program examples. Scrolling down, however, you can see that you can also access these particular sections just on the landing page itself. We have our webinars again, and some of the individual sections from within those different areas. So information for tribal leaders, separate information about planning and evaluation, the resources we have regarding state and federal relationships, such as state Medicaid plans and waivers. Again, access to our newsletter. The video profiles highlighting different LTSS programs in Indian country. Other various resources, such as our database of IHS, tribal and urban Indian programs. Our program structure, looking at the different types of LTSS programs, how LTSS might be offered in a home or community-based setting versus a facility, information on the Money Follows the Person initiative, and finally some information on financing, such as resources to help just the tribal communities with their financial planning and budget, and some resources also on different sources of funding available and how specifically those sources work. Also down here below, you can see that we have our FAQs, just to give you an idea about what the PA Center is actually purposed for. We do have a link so that you can send any questions via email if there are any questions or issues that you'd like to discuss about the website itself. Again, if it's an issue relating to a need for specific services, you would use the links above. We also, and we will discuss this in a little bit more detail later on, have created a LinkedIn page that you can use to engage in current event discussions and different topics regarding LTSS and tribal communities. That's meant to be a platform for different stakeholders, different directors, anyone with a vested interest in LTSS in their community to engage with others with shared interests. And we also have, of course, our Twitter feed that we use via CMS. So all these resources, again, are available right now on CMS.gov, but we will be making this version of these resources available shortly.
So some of the questions and comments that have come in through the chat box there's one piece actually, Adrian, that maybe you can, maybe we're going to point to it in just a minute, which has to do with the maps and locations of tribal clinics, IHS, and urban Indian health services. And we do have that, and Adrian will be going over that here, I think, relatively shortly. Some other comments are to a recommendation to clarify planning and guidance. There are some comments that page is a little bit confusing. The LTSS is not the same as post-acute care services. Medicare covers some limited post-acute care services, but not true long-term care services and support. With regard to the site itself, use of the title tabs and also the search engine tab, and that the breakdown for LTSS in Indian country is good for quick access to topics that were being sought out. Got a couple of comments saying that things are broken down nicely. A lot of people mentioned the pictures and the images on that front page. And then one of the other questions that we're wondering in conjunction with, what first stood out is, what do you see that you feel is missing? Or rather, what don't you see that you feel is missing from this page when you first look at it? There's a question about whether or not it would be possible to have status updates regarding Medicare and Medicaid for each state.
Well, that's certainly something we can look into, including, I will say, in terms of news about recent LTSS developments. Those are some of the things that we'll be sharing via the social media components of the site, such as the LinkedIn or the Twitter feed, and we can maybe make it a section within the site that those sorts of releases or those sort of new events, news and current events, can also be included in the section within the site. But thank you. That's exactly the kind of feedback that we're hoping to receive.
There are some suggestions about caregiver support, and that is a big enough topic to be included in our left margin. And a question about where are the facilities? The facilities should be included on that front page.
Okay, so that's actually, let me show it right now, but we will be discussing it a little bit more in a future slide. With regards to caregiver support, that is something that we're actually developing content for now. And so those will be additional resources that will become available. So I will say that what you see here is not the end-all, be-all of what topics that will be covered on the CA Center. So again, if there's additional areas that you would like to see more resources on or topics that you'd like to see us cover within the CA Center, please let us know so we can make sure that those resources are available. In regards to some of the programs themselves and the different resources available by state, let me just quickly highlight that particular section here, or that particular resource here. So as you can see here, we do have a database of ITUs, IHS tribally operated or urban Indian LTSS programs. And so how you can navigate this particular database, you have the option of either scrolling down and looking at the individual states. Things are the states and the programs within are listed alphabetically. As you can see here, we have the name of the programs. So, for example, within Alabama, we have Larch Creek Indian Services Development, city and state where it's located, their address information, contact information as it's available online. This particular program is Title VI grantee, and a brief listing of what types of services that they provide. So you can either scroll down. The other option available is to click on an individual state, so for example, Colorado, and that will automatically take you down to that particular state, and again, you can scroll through. We try to make sure that this is updated at least quarterly, so 4 times a year. That being said, if there's information that shifts or changes in between that time, and you find that there's a program that's either missing or needs to be updated, again, just please let us know. You can send us an email using the email address or comment box that you saw on the landing page, and then we'll be sure to go in and update that. That takes almost no time for us at all to do. But it helps us if those on the ground, who are the eyes and ears on the ground, keep us posted. So again, you can access that information through the info section. All right, so I'm actually going to go back to our slides, but again, if you please feel free to hang on that website if you would like to take a moment to check it out. So that actually is a pretty good way to dovetail into the first section. So again, we have the info section, which is our LTSS resource library. The resource library, as you've seen, provides information on a pretty wide range of topics. So that includes different LTSS models, financing resources, state and federal relationships, information for tribal leaders, on specifically how to talk to community members, and areas of research. So that includes things such as hospice and palliative care, looking at elder abuse prevention, that sort of I guess in a little bit more detail again. So there's the database that we just showed. Information for next state and federal relationships are, again, the national and regional LTSS resources, the list of annually updated state and Medicaid plans and waivers, and then, again, talking about some of the unique research that has been undertaken and are meant to provide resources on different topic areas on the website, funding for HCBS, that's home and community-based care, hospice care, tribally operated nursing homes, and issues affecting American Indians and Alaska Natives with disabilities. So let me go ahead and launch that site, that text for the site so you can see it. So as you can see here, we have as I said, our information on the different types of models, state-federal relationships, financing, research. If you go, for example, to the research section, which is, as someone had asked before, or commented rather earlier, that they would like to see more information on respite care and caregiver support, there will be information shortly available. Not shortly, but towards the end of the year, that will be made available on this section of the site. As you can see here, you can find sort of general information. We maintain a list of tribally operated nursing home facilities, different snapshots of programs, in this case, programs that have exhibited best practices in elder abuse prevention. So you can click on any of these particular items to access PDF versions of the findings from the research. And they're free for you to download. You're welcome to download those and distribute as you see fit. We also provide information that's perhaps a bit more academic in tone. We have literature reviews on different topics. Again, looking at things such as hospice and palliative care, funding. And then One other item that we also have, which unfortunately we won't be able to demonstrate as much as we would like to, we have some videos that you would be able to see that highlight different practices in terms of what works for LTSS programs, sort of general discussions about practices that programs have been able to utilize with a degree of success, as well as highlight the individual programs themselves and the particular environments or challenges that they face and how they've been able to overcome them. Unfortunately, just due to some constraints with our platform, we're not able to play these for you, but we definitely encourage you to go to the site, play them yourself. There's wonderful videos, and they also provide great compendium pieces to use when discussing LTSS, either with funders, with community members, with tribal leaders, and vice versa. If tribal leaders want to have these sort of discussions with various stakeholders or organizations or other community members, these are also great tools to use to really build up those conversations. Are there any comments or questions about the intro section? Okay. So then we'll move on to our next section that we wish to highlight, which is the planning section. Now, the planning section is meant to help individuals, no matter where they are in the planning process. So that includes either being ready to go ahead and put a program into place, or on the other end of the spectrum, if you are just starting out. So within our start planning section, we have information meant to be a little bit more basic, such as LTSS models, the different types of models available, including models other than facility-based care or HCBS, and also, again, information on financing, such as planning steps, how to apply for grants, and what sort of funding sources are available. You'll note that financing was also discussed in the info section. The idea is that the content within different sections can be accessed through various different channels. So while financing is information is useful to those in the planning mode, it might also be something that someone who just wants to find general information would be curious about. So we want to make sure that no matter who's interested in what, that they have multiple avenues to use in order to find that information. As mentioned, also we have a section on advanced planning. Within this section, you would find our LTSS roadmap, which is a more hands-on guide to help walk users through the 7 different planning steps to help design and implement and evaluate an LTSS program within their community. So that actually walks you through the needs assessment all the way through the program. And the idea being that you can use whichever step you are currently at and then move forward through there. It also includes a series of resources on evaluation, including how just to conduct a program evaluation. It's meant to provide more basic resources. We are in the process of developing more specific toolkits. The idea being that we want to provide you with actionable items. But again, it's meant to be a resource helping people get through those particular sections. So why don't we quickly highlight that portion of the site. As you can see here, we have our information for individuals or for planners just beginning the planning process, as well as the advanced planning. I did want to quickly show you the roadmap. As you can see here, it is meant to offer step-by-step guidance in terms of determining the needs for LTSS within your tribal community, comparing models and choosing what model best works for you, for a community, designing and implementing that program, and then evaluating it to determine what isn't working, and how to improve it. Likewise, there's also resources again, on financing, how other communities have been able to implement such programs in their areas, and also how to gain support from tribal leaders or to use the resources available at state and federal levels. Now, we do have a few questions that we would like to ask you as our audience in terms of this section, particularly as it pertains to the roadmap. So, Kristen, I will hand this over to you.
Well, this question is actually a poll about how helpful people think the roadmap will be for their organization. So if you could just take a few seconds to go ahead and fill that out and click submit, we would greatly appreciate it. Okay, so our results show that the majority of you, 32.9, have a neutral stance on this. 28.6 say that it would be very helpful. 14.3 say extremely helpful. 9.5 slightly helpful, and 4.8 not helpful at all. So as a follow-up question, in terms of what you've seen so far that Adrian has shown you, what kinds of resources would you find useful that would help you with your program and its work? And again, feel free to use the chat or to speak up.
Just hold on, I'll be right there.
And on the flip side of that, perhaps, was there anything that you were hoping to see that you did not in terms of resources that you think might be helpful? Okay, we have some chat, literature reviews, educational guides, program evaluations from other states. What are things noted as helpful? The suggestion that caregiver support needs to be added, and that would be very helpful. We're actually working on putting together a literature review and best practices on caregiver support and respite care. Details on how to draw 100% financing, any opportunities for flexibility in Medicaid requirements. Okay. Alignment with HHS National Quality Strategy and CMS Quality Strategy. Thank you for that. Examples of how tribes have learned to work across departments to address LTSS needs that are not necessarily cross-departmental. And applying for grants. These are great suggestions. Thank you. So in terms of users for this site, who else from your department, tribe, or community do you think would find this information helpful? Oh, backing up a little bit, some more suggestions are resources for needs assessment analysis for tribal members' needs in relationship to type of insurance, etc. Working on different facets of dementia care, so providing some information around that, particularly around setting up funding and people to help. And it would be beneficial if responses were broken down by tribe or community. So we just shift gears a little bit to who in your community do you think would make use of this site, could make use of this site? One of the things that we strive to do is to try to make the site as user-friendly as possible. And so it would be helpful to us to know, for instance, who our audience might be beyond tribal health department heads and people in the medical community. Who else might we need to think about speaking to specifically? Someone's noted that in regards to coordinating care for elders, the site has some good resource information, discharge planning staff, nursing homes that are non-tribal. That's a good point. To the person who pointed out the needs assessment step, we're actually getting ready to move into that phase. It's under our roadmap. And then we also have grant information under financing. In terms of other users, someone's made the point that it would be more likely to be utilized by providers and consumers, which is primarily geared towards, and that tribal council members, planning committee members addressing the needs of tribal elders and disabled members. Okay. Thank you very much.
Okay, thank you everyone for that. We just want to highlight a few more aspects of the website, and then we'll open it up to questions. So moving on, we have our program examples. Within this section, we are using this area to actually highlight really what's going on in Indian country. So it's stories from real programs that are currently in operation, both facility-based care providers as well as HCDS. And then it's meant to highlight a range of different environments again. So looking at those provided within reservation areas, as well as those used in urban areas, urban-based programs. And again, we also make sure to include programs that highlight best practices in the lower 48, as well as those in Alaska. Now, again, we also have our program videos, those that I demonstrated a little bit earlier. Unfortunately, we won't be able to play one for you today, but if you have a chance to, we really do encourage you to go to the site and play a few of the videos. And they are very well put together, and I think they do a wonderful job of demonstrating what already works within Indian country and what different groups and programs have been able to utilize in terms of resources, both local, state, and federal, in order to provide these services to members within their own community. So as you can see here, we have our program example page. We do have a few programs that we've done just right up front. So, for example, we have the Cherokee Elder Program that you can see here with a very basic description of the program itself, including what services they provide. Oh, excuse me, I think what services they provide, who's eligible for services, and what the program has actually been able to utilize in terms of funding. And in this case here, they use a PACE program. And as you can see here, there's additional resources for individuals who might be interested in finding out more information about PACE. In addition to the program write-up, we also do have, of course, our videos. Those can be accessed on the landing page in the corner here. And then as sort of speaking again to the ability to access information through multiple venues and areas of the site. If you have questions or you want to find out more information about the different kinds of LTSS models that are available, we also have made it a point to provide a link for that information here. So in terms of the program examples that Adrienne just walked everyone through, and I know it was a short look, but which of the programs reviewed most resonated with you in terms of, for instance, your needs?
And just as importantly, do you know of any other successful or innovative programs that we could be looking to profile? Cherokee Nation is the only piece in Indian country. Any other suggestions? This is a suggestion about looking at LTSS programs or services that correlate to which quality improvement organization.
So we've got this.
Autumn Nation, South Arizona Behavioral Expression. Mm-hmm.
I'm sorry, did someone else just make a suggestion as well?
I wanted to add that this question about what successful or innovative programs should be profiled is a question we want to keep open long after this presentation is over. So we hope that if any of you know of programs or come to learn of programs that you think are particularly successful or that they demonstrate something that other people in Indian country should know about, please let us know on an ongoing basis, because we're always looking for programs to profile. And if you think that your program is doing something particularly innovative or successful, let us know about that as well, please. And you can contact us at LTSSinfo@kaufmaninc.com. That's the email address that is in your welcome box.
Someone suggested a reality show, Fort Gamble.
We can always link to it.
Go ahead, Adrienne.
Okay. Just to wrap up, we wanted to show you a few of the other resources that are available on the site. We do, as I mentioned before, have a monthly email newsletter that is made available to our list of members that highlights different LTSS news and funding opportunities, as well as different TA-centered schools and resources. So sort of a snapshot of what we're doing today. And we also have our monthly webinars on different LTSS topics that are given by various experts from across the country. I don't mean to include myself or Kristen in that particular description, but they are meant to provide information on a variety of topics. So just quickly showing you guys what that looks like, what's on the site itself. We do have newsletters that we started only last year, so there's not quite as many as there are webinars, but you can come here to either sign up for the newsletter or you can opt to just view the individual newsletters. As you can see here, they cover the most recent issue, or rather the issue from July, covered issues such as case sickness and medication side effects, what that implication could be for elders within your community. An interview with Dr. Jordan Lewis from the Center of Alaska Native Health Research, talking about a study he did looking at Alaska Native elders' perspectives on aging, what they have to say about maintaining a healthy aging strategy for themselves. We, of course, preview our webinars that are coming up in July. Rather, the webinar looks at nursing home best practices. The website feature that was highlighted during this time was a video that we've done looking at culture and community and using that as a resource in order to provide LTSS services. And then there's also other featured resources. In this case, it was a discussion of an all-tribes call that took place in June. Likewise, with the webinars, if you go to the webinar section of the website, you can come to this and find out, more information about upcoming webinars. And then also, as you can see here, we have webinars going back to 2012. You're welcome to go through our library, just click on any of the ones that strike your fancy, and listen to the discussion that took place. And finally, within the TA Center, we have our social media resources. And so specifically, we are referring to our Twitter feed, the LinkedIn group, and the email newsletter, which you can sign up for or opt in or out of, that are meant to provide a forum where individuals who are on the ground can exchange ideas, comments, or engage in discussions about relevant topics, either issues that they're currently dealing with, resources that they've discovered, or what their experience has been in providing feedback in those communities. And so we do welcome your participation in those.
How about you?
Following CMS on Twitter if you do have it. Also, within LinkedIn, those groups, so just go ahead and put in a request to join, and you can sign up to do that. And there'll be multiple discussions that will be starting with the message board there in an effort to engage more open discussion about topics that are relevant to you, to our audience. And that is roughly our center and our website in a nutshell. Kristen, I will hand this section over to you.
So we have a couple more questions to round out, or asking you of things. So our first is a poll question about how easy did you find the site to use? If you take a couple of seconds to choose your answer and hit submit, we would greatly appreciate it. Excellent. 73.7% find that it's easy to use. Wonderful to know. Or very easy. Excellent. Our next poll question is, how likely do you think you will be to use this site? Wonderful. The majority, 88.3%, are likely or very likely to use it. So we have a couple of open-ended questions we'd like to ask you before we give you a chance to ask us some more questions. So we could advance to the next slide. So just to follow up on some of the things that you've seen today, what content areas did you find to be the most helpful? Best practices? Anything else? Availability of up-to-date information. Suggestion to give tribal nursing homes and tribal assisted living homes a special place on the website. Consider that suggestion. Some of these suggestions have come up already, but are there any additional resources or materials that could be included on the site that you think would be helpful to you or your organization? Someone noted that the examples of the LTSS programs and planning support services are helpful. Someone has noted not combining nursing homes and assisted living as their district. Someone plans to share the website with all tribal nursing home staff. We have a question. I don't know if any of our team know this. How many American Indians in the nursing home are in nursing homes across the United States?
I don't know that we have an answer to that particular question. I think when we were doing some of the research into that particular topic, we discovered that there's a lot of different factors that play into, who operates a nursing home, whether it's run by the tribe or the state, and then also if they provide services to individuals other than tribal members. So unfortunately, we don't have, or rather I don't have it to say a hard answer to that. If anyone, however, attending has an estimate, we would very much love to hear it.
I think that numbers also hard to come to, if I recall, because a lot of times it relies on self-reporting, and sometimes also the reporting at the nursing home level, which isn't always as accurate, perhaps, in some cases. We have a comment that the CMS news strip on the right-hand side has good information. Okay, well, I want to be mindful of our time, and I want to make sure that the audience has a chance to ask questions as well. So perhaps we should move to the last slide. So does anybody have any questions that haven't been addressed or mentioned so far in the presentation?
We'd also like to add that if there's a question that you have following the presentation, or as I suggested, you decide that perhaps your program would be one that you'd like to see highlighted in our best practices, please don't hesitate to send us an email. We can be reached at LTSSinfo@kaufmaninc.com, or you can actually reach us through the website in response to this particular webinar using the email box on the site. Now, are we receiving any questions, Julie or Kristen? Unfortunately, I can't see them on my end.
No. Any questions at this point? Oh.
Okay. Right. Well, then, we want to thank everyone for their time. Oh, sorry, Kristen, was there something that came in?
No, it's just gotten some very nice thank yous. Thank you all.
Oh, thank you. Well, we are happy that this is a resource that can possibly be of use to you. Doing good work out there in Indian country. Of course, we can only make this as useful as we see or based on your feedback. So please don't hesitate to let us know what we are doing right or what we can do better, because we always strive to do better. Thank you all very, very much again for your time. Just to reiterate, if you would like to watch this presentation again, it will be posted on the website within the next few weeks. Or in the meantime, please feel free to go and watch some of the previous webinars or head out to any of the other sections that we've highlighted to identify resources that might be of use to you or resources that would be of use to you and that should still be developed. Thank you again very much on behalf of my colleagues, Dr. Kristen Hudgens and Sarah Peterson. We thank you for your time and hope you have a great rest of the week.
This concludes today's LTSS webinar series.